World Immunization Week is a global healthcare event typically celebrated every year in the last week of April between 24th and 30th of April. It intends to promote vaccine usage and protect people of all ages from infectious diseases. The theme for the 2023 World Immunization Week is the Big Catch Up. Spectrum Television was out to sample diverse opinions on immunization, its benefit, effect, and the myths attached to vaccines.
World Immunization Week is a global healthcare event celebrated from 24th to 30th of April every year. It seeks to promote the usage of vaccines. This year's World Immunization Week is themed The Big Catch Up. Join me as I sample diverse opinions on immunization, its benefits, effects, and the myths attached to vaccines.
Immunization Week, usually I always say, like any World Health Day that marks something or promotes something, it's just about bringing that thing to the forefront, top of mind. So Immunization Week is just to remind us that of the efficacy of vaccines thus far, especially once they had started having vaccinations and immunizations for children and everybody across the world. It's just a reminder of how effective that has been and then what we can do going forward. In Akwa Ibom State, we vaccinate our children every day of the week. So it's just a reminder that's why I said, so the week, it's not that the week is set aside to vaccinate children. It's something that we're doing constantly, day in, day out. It's just a reminder of the importance of vaccinations and immunizations. So it's been ongoing.
Immunization is basically introducing little quantities of disease-causing organisms, parts or whole, or it can be an extract, into the host, which is a human being, to evoke immunologic response. So that when these organisms come back again, there's already an immune defense system that identifies these organisms and help you combat those illnesses better.
Okay, immunization, the essence of immunization is to confer on people immunity over a particular ailment. Take for instance, COVID-19 virus. People are being asked to vaccinate now so that by the time they vaccinate it, they now have an immunity over the virus, so that even when they get in contact with the virus is unable, to be injurious to their health.
Generally, immunization is very, very vital and important in the health of the people, because immunizations go a long way to leave the system with that adaptability to fight the different diseases of which the vaccine or the immunization was given. So there's this old saying that says prevention is better than cure. So immunization prepares the system to prevent the persons from coming down to these diseases. So it is better.
To a layman, if I was to explain immunization, I would say there are those preventive measures or vaccines you take before an illness begins.
Since the introduction of vaccines, statistics say the global mortality rate in children less than 5 years has dropped drastically from 93 per 1,000 live births in 1990 to 39 per 1,000 live births in 2023. In spite of this, many women and families fear immunization. Others refuse to be immunized, while some do not know the age ranges for immunization. We spoke to medical professionals and citizens asking them, it is not enough to know what immunization is. Has your child been immunized? What are the age ranges for immunization?
Don't 1 month to 9 months to
Yes, from 1 month to 9 months now.
That was when I was a little child, when I was a teenager, and so
all our children, as soon as they're born, are supposed to get their basic vaccinations.
It depends on the type. We have the ones for children, and most of them, if by the by 1 year, 6 months, we've completed most of those ones. But there are still booster doses at 2 years and of these immunizations at 2 years and at 4 years. The immunizations that like the human papilloma virus, adolescent girls, tetanus toxoid, adolescent girls, COVID-19, adult children. So it depends on what immunization it is. So there's no age limitation to immunization.
We have immunization for babies. You have it cuts across almost all the ages, depending on what they are being immunized for. Don't forget, babies are more vulnerable to so many ailments, and so from the baby stage, a lot of vaccination is being given to them to avoid most of those common ailments that may come to them.
Usually for immunization, we say from 0, because there are some vaccines you take from when the child is giving birth to. So from 0 to about 6 years, there are different types of immunizations you take as a child keeps progressing with age. So from 0 we have BCG, that's for tuberculosis and all of that. Then we have the one for hepatitis that is taking around 3 months and thereabout. To a very large extent, it's almost like 0 to 6 years.
Remember, the goal of World Immunization Week is for more children, adults, and their communities to be protected from vaccine-preventable diseases, allowing them to live happier and healthier lives. However, there's a negative perception attached to immunization. What is the reason for this?
Vaccines, like any other medicine, it's a medicine. It's something you're taking externally into yourself. So yes, they do have adverse effects, but the effects vary depending on the interaction with the individual. So it's not enough to say I took a vaccine, I had a headache, and then the next person says I'm not going to go and take the vaccine because I don't want a headache. You might not get a headache, you might not get any adverse reaction, but we just let the children and the mothers, the caregivers know that, well, it's possible that there are certain vaccines that if you give your child, the child may or may not come down with some symptoms. Just immediately you see any other thing, please inform us. And usually on the vaccination card, we have the name and number of the what we call disease surveillance notification officer. So those are the people that track any adverse effects.
The negative aspect is just the side effect that some persons may have following immunizations. So you can have pain at the sites. There can be pain. There can be some tenderness. Okay, that's pain. Some can have fever. Some can even evoke some reactions. Okay, we have a lot of reactions. Children can have allergic reactions to what is contained in the immunization, and this is person dependent. Okay, so and those ones when you take to the hospital, they are properly identified and treated.
There are some resistance by the populace in vaccination because of the so many false rumors people had about vaccine. For instance, some people said if you take vaccines, you may turn to chimpanzee. If you take the vaccine, you will die after 5 years. If a female takes the vaccine, it may not be able to get pregnant. Infertility issue. So many stories have been said about the vaccine. But what is surprising to me about the vaccine is when the first story emerges, it spreads too fast. Everybody gets to hear about it. Most of these false stories has been debunked scientifically. They have given scientific proof that yes, this that was said, look at why it can occur. That was said, look at why it can occur. The other truth part of it don't spread as fast as the false part, and that is why, and that could be seen in the number of people that are being vaccinated because of the so many stories that I've read about its consequences. But I want to tell you that so many people are vaccinated. Some are vaccinated up to 2 years now, 1 year now. None of those people, including myself that are vaccinated, have witnessed any of those myths about the vaccination.
Regardless of these circumstances, there are 3 common vaccines in Nigeria. The 3 vaccines include BCG against tuberculosis, polio vaccines, pentavalent vaccines containing vaccines against diphtheria, pertussis and whooping cough vaccines, tetanus vaccines, hepatitis B, measles, and yellow fever vaccines. The government made immunization easy by introducing the door-to-door immunization. However, did you also know that most community pharmacies are free vaccination points?
Most of the community pharmacies in the state has been trained and certified to vaccinate in COVID-19. And so those centers are like government extension. And then the advantage of the community pharmacy is that you could actually vaccinate at odd times. The community pharmacy is always open, almost on every day, particularly up to weekends. And so you could walk in on a Saturday or Sunday and get yourself vaccinated. And so having the such services in the community pharmacy is for the benefits of the populace, so that they can have at least convenience of accessing health care at their own time.
It is safe to say that efforts have been made. Is the result commensurate with the effort? The federal government, through primary health care facilities, made for door-to-door immunization. However, the big question is, why do people refuse to be immunized, and how do we get more people to be immunized?
Well, it's sensitization, community sensitization. You don't stop doing, you keep doing it. You see, the more you sensitize a community, the more the acceptance of whatever you're sensitizing them against. That's number one. Number two is also having a strong system for adverse effects following immunizations. So it means if someone comes to the hospital and has an adverse effect, a side effect, you should have that primary health care center, that institution must have good ways of managing or referring, as the case may be. What happens is that when parents come and their children have these things and nothing is being done, the remaining people may likely not come.
We usually go from door to door for immunization programs, and the occurrence is where you go to some places and the mothers will be like, Dad will not allow them take it. And I feel it's more of orientation. We go into those villages, those places, speak to the parents, speak to the mothers, let them know what will happen if the child is not vaccinated, if he's not immunized. Try to talk to the dads, because the fathers are like strongholds mostly. So talking to the parents, showing them, like I feel like most times physical pictures make people understand things. Yes, so show them pictures of children maybe who have meningitis, measles, because we're not vaccinated and all of that. It will help.
Concerning the resistance about immunization, it also has to do with our level of education. Like you mentioned, the North, over there their level of education is very low, which means our government has to still do more to make sure the citizens are educated. Making education a right and not a privilege in the country will go a long way, because if they understand what you are saying and the advantages of the immunization, they will not hesitate to take the immunization. Again, maybe because most of the immunization, like the ones against polio, are free, people are skeptical, because again, our government have not been in the business of delivering to the citizens those basic things they are supposed to deliver to them. Now they now see you are bringing this free, they suspect it. Like in the North, they will say they want to reduce their population with the immunization that they are giving them. Maybe because again, the government have not been doing the right things they were supposed to do over time.
Nigerians, 2023 is our global opportunity to catch up on lost progress in essential immunization. If you are scared of the negative effect of immunization, the benefit outweighs the risks. For instance, vaccines lessen the chances of getting sick, and vaccinations at the right time can help in activating the immune system without harming the body.
It reduces disease burden. Okay. Now, reducing the disease burden means you spend less money on an ill child. The child is not out of school. If it is for adults, something like cancer of the cervix is easily preventable by immunization. Like the COVID-19, it reduces the mortality from COVID-19 infection.
You cannot really compare the positive to the negative, because the positive, overwhelmingly outweighs the negative. Taking a vaccine, someone that takes a vaccine for any ailment stand 100% better a chance than somebody that didn't take it. And so the benefit outweighs any risk at all that may be associated with it.
Hitherto, everyone is advised to be immunized, especially children, so they are shielded from avoidable diseases and we can build lasting protections in our communities. Meanwhile, the citizens and medical practitioners are advising everyone to get immunized to improve the quality of life.
Definitely, I would like to encourage the nursing mother to subscribe to the immunization treatment, because it's very good for the health.
It's very bad rejecting immunization because it's also good for your baby health.
Oh, the message is, please, when it comes to your vaccinations and immunizations, please go out there, avail yourself of what is there for you at the primary healthcare facilities. Usually the vaccinations that we have, they come through the primary healthcare development agency pathway. So from the national primary healthcare, they send us the vaccines, and we have a very good cold chain system that from the state store, it's sent to the local governments, from the local governments to each of the facilities. So you have nothing to fear. Once the vaccines are there, please go and take your vaccinations, and they're free. They're actually free. Those vaccines are very, very expensive. Right now, the organization that helps to support the country with getting the vaccines, the Gavi, or Global Alliance for Vaccine and Immunization, they're spending so much money for us. So when they send it to us, and it's not just something that they're throwing to you. Remember, it's a global village. What affects us in our little village here in Iran will affect somebody, far away in Copenhagen. It might seem unlikely, but what if somebody from here travels over there with a disease? Or what if somebody from there comes here for some mission? We are likely to interact much more than we think. So if we're safe here, we're safe all over the world. So please go out and take your vaccines.
Yeah, World Immunization Week, a lot of sensitization is going to take place. We encourage those that have not had their normal routine vaccine like COVID-19 vaccine to avail themselves the opportunity. With this reminder, they should go and get their vaccine and be rest assured that there won't be any consequence. At worst, there could just be one or two slight symptoms that abate within some few hours of days.
My advice to people is they should embrace immunization of the different disease. They should embrace it. It will go a long way to keep us healthy. And a healthy nation is a wealthy nation. So that's my advice. Let's embrace immunization.
Okay, for the immunization week, mothers in particular, please, let's take this immunization seriously. Our babies need to be healthy and grow properly. We see babies here a lot. This is mostly a pediatric hospital, and it's so sad when you see those little ones that barely know nothing, fall ill. So I feel like mothers should take it upon themselves to please go vaccinate their child, go immunize all your children on time and at the appropriate ages. Thank you.
Vaccines help reduce the chance of getting sick, and vaccinations at the right time help to activate the immune system without harming the body. Therefore, everyone is advised to be immunized so we can be shielded from avoidable diseases and build a healthy nation. My name is Blessing Dixon, reporting live for Spectrum Television. Enjoy the rest of our programs.